Hello, my name is Alexis McWhorter, and I'm an MSN student at Eastern Kentucky University in the Family Nurse Practitioner Track program. This presentation will discuss the importance of increasing medication compliance in patients who have been diagnosed with heart failure. Heart disease is the leading cause of death in the United States. It is estimated by Healthy People 2020 that patients with heart disease account for $320 billion of healthcare expenses annually. The significance to improve overall treatment plan regimen is crucial to promoting overall wellness in these patients. More specifically, the need to improve medication compliance for patients diagnosed with heart failure is key in not only improving patient outcomes and quality of life, but also in decreasing the expense and work on healthcare systems. Because some of these medications make patients experience unpleasant side effects, they may be more likely to be non-compliant. For instance, patients newly prescribed the diuretic should be told before initiation that the purpose of these medications is to decrease fluid and therefore they will be used in the bathroom more frequently. Some medications for blood pressure may make the patient feel tired when they initiate it. At the forefront of this project implementation is education. The intervention proposed is the implementation of a specialized advanced practicing nurse in heart failure to act as a nurse navigator and to follow these patients at the primary care level to better support them as they manage a new or existing heart failure diagnosis. A systematic review done by Rupar, Cooper, Mayer, Delgado, and Dunbar-Jacob displayed that the use of specialty nurse in diagnosis of heart failure have been proven ineffective in increasing medication compliance. The theoretical framework for this project is Pender's health promotion model. The basis of this model is considering patients' behaviors in reference to their personal experiences, personal values, or personal beliefs. The best way to efficiently manage a patient with chronic illness, in this case which is heart failure, is to promote their independence to manage their own care. In seeing that they can improve their own quality of life, the patient may be more likely to be compliant with care. By considering their personal preferences, values, prior experiences with healthcare personnel, or perceived barriers to action, the advanced practicing nurse can develop a personalized treatment plan, including ways to promote compliance. The action plan discussed for this project is firstly, identify patients in the inpatient setting diagnosed with heart failure exacerbation that are less than 24 hours from being discharged. This is so the education and information is fresh, but will be followed up throughout the primary care level to be reiterated. Obtain written informed consent for participation. Patients must meet the following criteria to participate. They must be over 18 years of age, diagnosed with heart failure, being discharged on a beta blocker, ACE, ARB, or diuretic. If the patient has an EF less than 45%, according to the American Heart Association, they should be ensuring that they're compliant with these medications to manage their symptoms. Specialty heart failure advanced practice nurse visits the patient in the inpatient setting for the first educational session of 1 hour for education on the importance of compliance to medications, as well as signs and symptoms of fluid overload, importance of adhering to prescribed diet, as well as answers any questions that the patient may have on new side effects of their medications. Specialty advanced practice nurse follows up with the patient via telephone, Skype, or in-person follow-up at the primary care setting at 2 weeks, 4 weeks, 6 weeks, and 8 weeks and 4 days, for a total of 60 days. The follow-up will be done using the Morsky Medication Adherence Scale 8, which is also known as the MMOS-8. The follow-up is different because of the varying socioeconomic barriers patients may face to be able to follow up in the primary care setting, so multiple methods of communication will be offered to the patient. The Morsky Medication Adherence Scale, or the MMOS-8, rates the patient's medication compliance. It asks the patient, do you sometimes forget to take your pills? Did you take all your medications yesterday? And personal preference questions like, do you ever feel hassled by adhering to your medication regimen? These questions can not only assess medication compliance, but can better help the advanced practicing nurse understand the why behind noncompliance if they are noncompliant. The follow-up advanced practice nurse will assess the MMOS-8, like I said, at 2 weeks, 4 weeks, 6 weeks, and 4 days for a total of 60-day follow-up after a heart failure exacerbation. If outcomes seem to be improved by the implementation of the specialty advanced practicing nurse, it may be beneficial to consider this as an accepted practice for highly readmitted populations like those patients that are diagnosed with heart failure. The timeline of this project will consist of 4 quarters and an additional pre-work before quarter 1, as well as a follow-up after quarter 4. Before quarter 1, identify participants and stakeholders for the project implementation, which would be patients, hospital, primary care practice. Then we'll determine project leadership, which the specialty nurse is going to be the leader for the project. Conduct search for internal and external evidence on the topic of medication compliance and heart failure. Although there has been some done in the past, there is a need for continued. During quarter one, the action plan discussed previously is implemented. During all the quarters, the multidisciplinary team will meet on the last Friday of the quarter, which is every other Friday. During all quarters 1 through 4, the specialty nurse follows up via phone, in person, or Skype to assess the patient's compliance using the MMOS 8. After quarter 4, the outcomes will be reviewed and it can be assessed if the implementation of a strict education regimen as well as strict and frequent primary care follow-up for patients with heart failure exacerbation will be of benefit. Research has been done on the topic that have shown implementation of this type of nurse navigator can be effective in managing chronic illness, like those who are diagnosed with heart failure. As it is a lifelong waxing and waning disease, it is important for this diagnosis to be managed at the primary care level to prevent any further decline of quality of life or more frequent exacerbations, which would lead to rehospitalization. The implementation of this project can better help the advanced practice nurse. Note if more rigorous education by a specialty heart failure nurse would be of benefit to advanced practice nurses in the primary care setting, as well as promote improved patient outcomes. Thank you.